Again, good morning po. May nagtatanong po kanina sa labas, ano yung ibig sabihin ng MDG? This is the Millennium Development Goal. We have actually 8 goals. Ito po yung goal ng buong mundo. In 2000, nagkaroon po kasi ng pagsasign ito, commitment signing ng 109 countries, and one of which is the Philippines. So, MDG number 6, or the Millennium Development Goal number 6, includes all the infectious diseases, specifically malaria, TB, HIV, and other infectious diseases. But I would like to start with, of course, yung sikat na yung mga panahon na to. And this is, ganito talaga ito. Ayan. Ganito talaga ito sikat. So, the most popular this season, we have, of course, the Dengue Control Program. Okay, so, ayan po. So, I'm giving you the surveillance report of our rescue for Morbidity Week 29. If you can see, this is listed according to provinces. And in Pampanga, recently, there was a clamor that there is an outbreak before Pampanga, but upon investigation, it was actually cases of January to June to present. So it's not actually an outbreak, but there is already increasing of cases there. As you can see in this data, we have, of course, Aurora, 27 cases for the Morbidity Week with no mortality, and Bataan with 307, 1 mortality. So ang CFR po or the case fatality rate falls under 0.3. Our goal is below 1. So okay pa din po yan. Bulacan, 617 with no deaths reported. Well, Nueva, 828, 1 death. Pampanga, 784, 2 deaths. And Tarlac, 414, 2 deaths. Zambales, 202, 1 death. Giving Central Luzon a total of 3,179 cases and 7 deaths, which is actually 43% lower than 2013. Okay, so makikita po ninyo, we have last year a total of 5,613 cases. No? While this year, on the same period, this is the same morbidity week, we only have 3,179. So most of the provinces actually have lower their cases. So a big hand for all of you. As well as for the mortality. So both morbidity and mortality has actually decreased or reduced to a remarkable number. So what has been done for the program since January? We actually have conducted the dengue vector surveillance training. Actually, it's already batch 4. This is to capacitate provinces to have their entomologists or RSI or even nurses and medtechs to do vector surveillance so that we will have a concrete estimate if there will be an outbreak. So, lalo pa lang po na sa surveillance na natin kung nandun siya sa mga lugar, kung mataas ba ang density nila, para po hindi na tayo magkaroon pa ng kaso. Unfortunately, syempre, ito pong pang-apat na batch, hindi pa po sila enough to perform the surveillance, but we are hoping that this year, makapag-establish na po ng dengue vector surveillance each barangay of each municipality of the 7 provinces and 2 chartered city of Central Luzon. And of course, we also had our allocation of commodities. Regular po to, every quarter kami po ay nagpe-proposition ng mga commodities sa mga probinsya. So if there will be need for it, besides the routine, ay pwede po rin yung puntahan ng mga PHO, Provincial Health Offices, kasi doon po bumabagsak ang mga commodities namin for each of the municipalities per province. So the latest that we provided were the following. Ito po yung mga items na naibigay sa mga munisipyo, even in public schools and both elementary you have this to be distributed to the different schools. Ang target po namin nito, when we allocated this, sana by June na ilagay. So kung hindi po nakuha ng province po nila. So there also has been, so yun po yung iba-ibang items. Ito na po iisa-isahin. Mapapansin nyo lang lahat po ng barangay sa RH2, pinrovide po namin ng poster and tarpaulins for dengue, supuin ang dengue. Nasa Tagalog po yun. And ito po mga latest na pinadala namin sa inyo, the allocation for the second quarter and the third quarter. So we gave Sumilar or the pyriproxyfen, which is a larvicide. Ayaw ko kasi medyo, anyway. Ayan, for the provinces, we already gave larvicide, yung po nasa right side, your pyriproxyfen, and of course, also we gave also insecticide for fogging just in case, because in Nueva ecija, there were already reports as early as May, and as early as June. Although we already gave the first allocation before June. But we also had additional as July 14, for all provinces and cities. Particularly cities, kasi ito po, alam naman natin, although dengue is already occurring in both city and rural, mas marami pa rin po sa city. So nagpadala na din po kami ng iba't ibang insecticides. So Pescard and Resigen and Bocula are your insecticides for space spraying, while your Sumilar or pyriproxyfen are your larvicides. So everybody from Aurora to Zambales, including the different cities, were provided. Kung hindi pa po ninyo nakuha, baka nasa supply, pero ang huling report po sa amin na supply namin, all commodities were already at the provincial level. Okay. So what happened last June? Ang June 15 po was declared the ASEAN Dengue Day. This year, the theme is unity and harmony within the ASEAN community, key in the fight against dengue. Fortunately, for the fourth celebration, Philippines po ang nag-host. So every year, iba-ibang ASEAN, Southeast Asian countries. This year, Philippines po ang nag-host. At ang napili po ay ang Central Luzon. Ang mga honorable mayors, alam naman namin very busy sila. So that they will be updated with the latest on EBOLA. Ano po yung EBOLA na yan? So this is actually a severe infectious, often fatal disease, kasi 55% na ang mortality, in humans and in primates, caused by infection from EBOLA virus. Magkakaroon din po ng sharing tomorrow because in case nagkaroon ito in Pandila. Tomorrow, Dr. Ram. So how is this transmitted? It is actually by close contact with blood, secretion, organs, and other bodily fluids of infected animals. Sabi nga, pati pawis. Kung napapanood yung mga news, nabanggit na po yan ni Dr. Lincoln sa kanyang mga interviews. Body fluids, stools of infected persons. Objects such as contaminated needles and sardine used by a patient, and the body of a deceased person. Okay. What is the incubation period? It's actually 2 to 21 days. So, tingnan niyo po yung mga karabing ngayon. Mga galing yan sa mga lugar sa Africa. Hindi niyo ba makikita ang signs and symptoms like this? Kasi 2 to 21 days po ang incubation period. Signs and symptoms will include fever, headache, intense weakness, joint, and muscle pain and sore throat. Parang wala kong pinagkaiba sa kaso, di ba? It is followed either by vomiting, diarrhea, stomach pain, rash, impaired kidney and liver function, and in some cases, both internal and external bleeding. So they can actually go severe. Kaya po ganyan. They can So as long as nandiyan siya sa inyo. So, do we have treatment or do we have vaccine? Suspect cases should be taken to the nearest health unit immediately for medical attention. Severe cases require intensive supportive treatment. Unfortunately, there is no specific treatment or there is no vaccine yet. So who are the people at risk? Healthcare workers. Kasi tayo po, no? From the healthcare side, tayo po yung mas exposed sa mga nag-accident. And of course, laboratory workers. Both from animal and humans. How do we prevent? Just like any other infectious disease, no? We have to avoid close contact with infected patients and possible infected animals, like foot baths or monkey, egg, and consumption of their raw meat. Wala po sinabi dyan na mukhang monkey. No? Monkey po. Yung pwede na, mukhang monkey, pwede na po dyan. You have to wear gloves and appropriate personal protective equipment when taking care of the patients kung nasa bahay na. And of course, sabi ko nga, hand washing, no? Isa din, hindi lang po sa EBOLA, sa lahat po ng infectious diseases. No? Pag ginawa niyo po ito, isa din po itong prevention. So you have to do hand washing after visiting sick relatives in the hospital and after taking care of the patient. So that's all about EBOLA. So the second infectious disease is malaria control program. Probably not all of you are interested with this because not all are endemic for malaria. There are only provinces, municipalities that are endemic for this. But for the benefit of all, maganda rin naman po kalamin, di ba? Kasi meron po tayo dito sa Central Luzon. So we do our stratification by provinces. Control phase, elimination phase, pre-elimination phase, control phase, and maintenance phase. So the following are being listed as per category. So lahat po ng mga yan, ibig sabihin ang probinsya ng Aurora, endemic for malaria. And they still have the following for pre-elimination phase, like Bulacan. Elimination phase would include Malaria, Aurora, San Luis, while maintenance phase would include Kasiguran, Vilasab, Dimaculaw, and Dinalungan. For Bataan, yung kung makikita yung 2013-2014, that's the stratification based on the year. So we have actually Dinalupihan, Limay, and Baga under the elimination phase. So ibig sabihin, sporadic na lang po dito, parang anak ang may kaso sa loob ng 1 hanggang 5 taon. While sa maintenance phase, wala na po silang kaso, magli-5 taon na. Kasi after 5 years, they will be evaluated kung wala na pong indigenous phase, they can actually be declared as malaria-free. So for Bulacan, hindi pa kasi tapos ang certification, later papakita po natin yung iba. For Nueva, we have still Gavan City and General Nino in the pre-elimination phase, meaning they still actually report cases once a month for less than 6 months. Okay, a year. Next slide. For Pampanga, Tarlac at Bulacan lang po ang endemic, so they don't have case. There's now in the maintenance phase. For Tarlac, ito po. Tarlac still under bomb control phase. Tatlo pa po yan. Bamban, Kapas, and Mayantok. The rest, mas marami na po ang maintenance phase. For Zambales, kaya po wala siya dyan. Zambales is very endemic for malaria and sila pong lahat ay, sila pong 30 municipalities are endemic. Isa lang po ang nasa control phase and this is Subic. Okay, nandito na po ba ang taga Subic? Subic? Wala pa po. Alam niyo po ba na ang Subic hindi lang malaria siya ng mga mayagpag, no? Pati dengue. And they are now invited here because they too has a court. Siguro po nagtatanong kayo, bakit selected municipalities and cities lang nandito for the emerging conference? Yung po mga munisipyo na nandito, kaya po kayo na-invitahan because you are high risk for emerging and re-emerging infection. It's either you have aviary, no? Handa ba is here? Or meron po kayo mga wetlands, or probably you have airports, seaports, or an entry, no? Yung mas parang entry and exit point po kayo. So, kaya po kayo. Kasi may nagtatanong po nila, bakit yung kapit-bahay nila munisipyo wala dito? They can actually join us. We will have another, probably, or yung kung gusto pumunta pa tomorrow, sabi nga ni RD, with her permission, can actually join us. Okay, for the morbidity cases in 2013 of malaria, we actually have a total of 101 sa buong region. Kung lang po yan compared to 2010 na left na 1,000 plus. Unfortunately, last year, the year before 2030, which is 2012, mas mababa po tayo. Kaya lang tumaas po tayo dyan 2013 because there was an outbreak in Subic. Hindi po sa right-hand chain, ito po ay sa Batchawan, Subic. So, we had an outbreak there, kaya po dumami ang kaso. So, if we will remove the outbreak cases, it's just the same as in 2012. So, talaga yun po ang nagparami. So, for the mortality, natutuwa naman po kami balita na last year, isa na lang po ang mortality. Although the year before, wala. Ito po kasi nagkaroon ng outbreak. There was a breakdown of surveillance, that's why. So for the diagnosis and treatment, gusto ko lang pong ipaalam sa inyo, libre pa din po, ang diagnostic procedure, which is the malaria smear for the malaria control program. At lahat po ng gamot for malaria is still free sa program. So, i-refer nyo lang po sila sa mga RHUs and hospitals natin. And they will have their free diagnosis and treatment. So for the control program of malaria, we actually do basic malaria microscopy training for medical technologists. And napaka-special po kasi ng paghahanap ng parasite. So hindi po lahat ng medtech talagang may eye for the parasite. Mahirap kasi siyang mahanap din kung hindi sila masyaka. Kaya we do this kind of training. At pag mag-train po ang mga medtech nyo, after 3 years, kaya po have refresher course on malaria. No? So every 3 years, para po mas maging epektibo ang kanilang pagbabasa. So, katulad po ng dengue, in malaria, we also do allocate commodities for the different provinces and endemic areas. No? So, ito lang po yung mga nabigay, hindi na natin iisa-isahin. So, pati nga po mostly tokol dahil nagkaroon kami ng sobra ng disaster, pinamili na po namin ito. Okay. It might be not so easy for you to see this, but this is actually a copy of the latest allocation last July 14. So we have provided the different provinces and endemic municipalities for the insecticide for litter residual spraying and short po sa mga bahay, mga endemic areas. Okay. So yan po, no? We actually give out long-lasting insecticide treated mosquito net. Ito po yung insecticide, embedded na po yan sa ating mga kulambo. O yan po ang pinamimigay namin for malaria. And of course, pag ginagad ka ng lamok, may pagkakataon din na pwede ka naman makagat ng aso. So the next program is rabies control program. Ano po ba ang ginagawa natin sa rabies control program? So these are the following activities that we have conducted for the awareness. We did our regional rabies summit last March 25. Dahil March is the Rabies Awareness Month. We also had our health caravan in 2013 para po i-drumbeat ang aming campaign against rabies. And of course, we do our training every year, every September, which is the training on the management of animal bite among nurses, doctors. Isa po yung requirement for you to be certified as an animal bite treatment center. So nagkakaroon din po kami ng mga orientation on the DOH certification on animal bite treatment centers. No? So last year, September 11 to 12, and this year it's going to be October. So we also do regular evaluation of the program by tracking the performance and doing planning workshops. and of course the rabies pairs. Alam niyo po, ang DOH still provides the different vaccines. So, we have also the different vaccines, and we do also provide for the registry and the card. Next slide. And we already conducted in 2013 some monitoring activities sa inyong mga animal bite treatment centers. Unfortunately, syempre may mga nakita din po kami na mga bagay-bagay na kailangan namin i-correct. Naki-correct na po namin at that time. No, marami pa rin pong hindi nakakaalam na libre ang unang first and second dose of the vaccine. Diba po nila alam yun? Libre po yun, hindi na po kayo nangangailangan ng indigency certificate. It's being given kahit po sino ka. No? Mayaman, mahirap, may buhok, walang buhok, babae, lalaki, paglatong boy, bata, maganda. Basta po yung first 2 doses. In other municipalities or MDG, what they do, they give the 3 doses from DOH, first and last. Para bumalik, kasi 4 times po dapat. In other municipalities, meron din naman po mga MDGs na sila na din, nagiging free lahat po yan kasi yung munisipyo nila nagbibigay din, yung provincia nila nagbibigay. So kung 4 yun, 2 from DOH, isa sa local government, isa sa provincial government. So may mga ganito po mga animal bite treatment centers. And ito na po yung mga NACES, no? From September 2013 at certified na. Okay, next slide. Sige po, i-browse lang natin. Okay. Yan po ang mga latest na na-certified. For the human animal bites, ang nakakatawa lang po, the more the DOH give free vaccine, mas marami po kami nakikita ang animal bites. No? Pero okay lang po yan. At least nagre-report na po sila ngayon. Pumupunta na sa mga animal bite treatment center to access the vaccine. No? Ito lang po ngayon ang ating statistics on the animal bites. No? So napakarami, pero kung titignan niyo po, more of male, no, than female. So these are categorized per province and cities. So for the incidence rate, saan pinakamarami? This is from the province of Bulacan. No? Nakakapagtala sila ng incidence rate of 4.1 when we have to target 1.5, below 1.5, yung po ang target natin. Opo, dapat 1 case lang per million. So, kung titignan niyo po per province, asan po ba kayo dyan? For the first quarter of 2014, Bulacan has already reported 3 deaths. No? Compared to the first quarter of last year na 2 lang. Last year, the whole year, they have 13. Sila po ang nakapagbigay ng pinakamaraming kaso for Region 3. It was followed by Nueva, Tarlac, then Nueva Ecija, then Pampanga. The rest have 0 human rabies. So, pag sinabi natin human rabies, yan po yung mga namatay. So, last year we have a total of 19. So, this year, first quarter pa lang po, 7 na. Pag tinimes ko ito ng 4, baka umabot ng 28, sana wag naman po. Okay. Opo, dapat hindi na po tumaas hanggang 7 na lang. Ayan. Tawag daw kami sa mga mayors.
At this point in time, we have seen the updates on the status of human bites, no? Bites, animal bites. And I think the most simple and mura is really enforcement. Responsible pet ownership. Because kung wala pong kumakagat, wala tayong rabies. Diba? So, katawag tayo na sa lahat ng mayors. Kaya na po marami silang cases. So, ipapasok natin yan sa October daw.
Okay, sige ko nga. Okay. Thank you very much. So, for the status per province, yan po ang status mo from 2009 to 2013. So, tingnan niyo po kung saan po kayo nagbibilang ha. Yan. Para naman po sa
district hospitals. Yes, pero kulang pa rin. Tarlac po, this is centralized. Nasa Tarlac Provincial Hospital. Nandyan po ang ating PHO. No, what they do there is that all the mayors actually give allocation dun sa DOH. At dun po lahat pinapapuntaan ng patient. No, for Zambales, we actually have 5. So lahat po ito ay animal maltreatment. Meaning, they are providing rabies vaccine for free ng 2 doses. Okay. Medyo mabilisan po tayo dito sa STI at HIV. Ayan. Gusto lang po kasi natin magpaalam sa lahat ng infectious diseases, hindi pa rin naman po nakakaligtaan ng HIV. So kung titignan niyo ang trend at makikita niyo sa ating mga graph, tumataas in the Philippines. Okay. We actually have 18,341 cumulative HIV cases reported from January 1984 to April 2014. Ayan. So it has been increasing quite much, no? Hindi lang po exponential ang increase niya. Sabi nga nila, 812%. Okay. For the last 5 years, and there is one new infection. Ayan, next slide. There's one new infection every year, every 3 hours. And all 17 regions have HIV reported cases. So 17 po ang regions sa buong Pilipinas. Tayo po ay under Region 3, Central Luzon. Okay, so if we will look at the prevalence, no, sa ating female sex workers, mga male who have sex with males, ayan po ang nakikita yung graph. It is increasing with MSM. Men having sex with men. And kung makikita po nyo, mostly are young adults. If we look at it at the age group, tingnan nyo po yan, young adults, 15 to 24 years old. In Central Luzon, kung ilalagay nyo po, hanapin nyo siya sa buong Pilipinas. We actually account for 8% sa buong Pilipinas. Ayan. Siyempre, natalo tayo ng NCR. They account for 50% of the cases for the whole Philippines. We have, next is yung the rest, yung ROTC, hindi ko yun sa, yung rest of the country. And second po ang ating Region 4A, or Calabarzon. And siyempre tayo, 8%. So in Region 3, just to give you this graph na medyo malabo, gusto lang po namin sabihin sa inyo, we already have 197 new cases from January to May 2014. So tingnan niyo po ulit ang mga katabi nyo, kung ang normal. Dito po sa buong Central Luzon. Ito po, susunod. Asaan sila? Ayan, Aurora, Bulacan, Bulacan. Nueva, Pampanga, Tarlac, and Zambales. Ang nakikita niyo po violet, medyo malaki po dyan, yan po yung mga asymptomatic. At yung white, yan po talaga ang meron na tayo na-identify na ng AIDS. Okay, for the next, kung titignan niyo po, from 2011 to 2013, yan po ang ating HIV and AIDS cases. O, sige, tignan niyo lang po ang mga provision nyo at saan kayo. Masasabi po. For the distribution, next, picture na nila. Okay, for the distribution of HIV and AIDS cases in Region 3 and the national level, kung ipa-compare na po yan, Central Luzon, ayan po tayo. Ito, ang city, and of course, yan comparison to the national level. Mas pagpili lang ang lalaki. Kasi parang dito pa na. Madami talaga ang mental accessibility. Okay, as to mode of transmission, meron din pong graph. So, magtitingnan po ninyo, we have the different mode of transmission na report from January to April 2014. Bisexual, heterosexual, homosexual, perinatal, injecting drug and transfusion.
So, kung titingnan po, ito po ang Central Luzon. Bakit Angeles City? Sabi siguro Dr. Leonardo Santos. Alam mo yan siya. Binabantayan. Category A ka. Tingnan niyo po mabuti sa Dr. Santos. Kasi pag daw sila ng maghanap, ano kaya hinahanap? Okay. So, kasi pa po sila, they have their clinics kasi din. So, next slide. Kanina ang Philippines, so ito naman by year, dito po sa Region 3, no? Meron pang unknown. So next, so that's all about HIV. Siyempre po sinabi HIV, meron din pong TB, no? So kasi may TB, HIV program din tayo. For the National TB Control Program, okay, so ito po ang CTR for the benefit of the others. That's case detection rate. Ang TSR is treatment success rate. Ang CR is cure rate. So, kung titignan nyo from 2009 to 2013, no, fairly naman po, ang Central Luzon, tumaas din naman po ang CTR, ang TSR, at ang cure rate. No? Fairly. So, palakpahan naman po natin yung mga pag-workers dahil ito. Pagod na pagod sila sa rate. Next slide. By province, let's see sino po umabot sa ating 85%. So, 85%, the whole region has reached, no, the target. Cumulative. So, yan po, makikita nyo, nakalampas ang Bataan, Bulacan, Zambales, and Nueva City. The rest will catch up. Next slide. Ito naman po yung CTR all course of the first quarter 2014. No, yung kanina sa 2013. So, kung tutuloy po natin or dita, 4 times natin, ay aabot naman ng 85% ang Olonga po, no, ang Zambales, Bataan. No, times 4, kung every quarter po. Ano, Dr. Reggie, pinatawag ka ni mga 15 lang na. So, times 4, 60 lang. Sir, ang target natin 85. Ay, 90 na po ngayon, 90. Sa cure rate, tingnan natin. In 2013, ito po yung mga nakaabot sa 90%. Actually, konti-konti pa for Region 3 para umabot siya sa target na 90%. Pero sa 85%, tatlo na lang tapas. Sa 2014, kung titignan mo, tingnan po natin, no? Ito po ang first quarter. So, may mga provincia na po na umabot sa cure rate na 90%. And these are the provinces of sa Bulacan, Tarlac. Palakpakan po natin ang Tarlac. Okay. Nueva ecija, umabot siya ng 85. Kaya lamang, this year, 99. Hindi na po 85. Pero ako 90. Pero umabot po ng 85. Kaya pakanin natin ang Nueva ecija. 90 na po kasi ang target for this year. So, for the treatment success rate per province, wow! Almost all noong 2013 umabot. At umabot po ang Region 3 sa treatment success rate, which is a better indicator than the cure rate. So, parang naman natin. Para mag-move kayo lalo kasi malapit na mag-watch. So, for our first quarter, tumaas naman. Tingnan nyo naman po ang efforts, no? First quarter pala. Olonga po city na lang ang pupukin din natin. Marami pong, opo, ngayon kasi meron mga problema. Sila ba, we already have some intervention sa Olonga City. Okay, so to put you in a scatter map, kasi po sa TV, usually, ganyan po ang aming tawag, yung high CTR, low TSR, high CTR, high TSR, low CTR, low TSR, and low CTR, high TSR. Ang pinakagusto po sa amin natin, nandito tayo lahat, no? High CTR and high TSR. We're gearing towards there naman po. No? Ang isang ini-help pa rin namin ngayon is Angeles City because we are still in this quadrant na ayaw sana natin na natin siya. Low na ang CTR, hindi na sila masyadong nakakahanap, hindi pa rin sila masyadong nakakaramot. No? So, meron na din pong intervention. Ay, salamat daw nandito si Dr. Santos. Para aware po siya dyan. Dahil kung maghahanap po kayo ng HIV, lahat po na may HIV dapat ipatest ng 30. Yan na po ang protocol ngayon. Lahat po na may affected with HIV. And this is being provided, may services po tayo ganyan. Itatapos ko lang po ito. This is the strategies that we use. Mabilis lang. For strategy number 1, may 8 strategy po kasi sa TB, no? Siyempre, hindi ko na po ito isa-isahin. Pakita na lang natin. For strategy 1, no, that's our local localization of our TB control program. For strategy 2, we actually have the monitor of performance targets. So, yan ang mga indicators. Yung IPC implementation, ang ibig sabihin po niyan, ito po yung integrated, no? Tuberculosis information system. So, lahat po ng probinsya meron na nito. Okay, for strategy number 3, i-engage po ngayon not only public hospitals but also private hospitals. Meaning, pwede po sila maging referring for providing. So, pag providing sila, the program will give them the free drugs for TB. Next slide. For, yan, mga ano lang po, per province po sino ang mga engaged, no? Ito po ang mga engaged na in Aurora, wala. In Bulacan, we have 5 out of the 10 provinces. In Bulacan, we actually have 10 out of the 60 private and public hospitals, and provinces. 6 po sa private. Sorry, kanina is public, ngayon po, ito yung private. Bakit naka-highlight ang Premier Medical Center? This is the only providing private hospital. Sorry, Bulacan nakalagay. That's for the Messina. Typo error ko. I-edit mo sa akin yung number. Oo nga, no? Muli na Bulacan. And for Pampanga, this is also the only providing hospital, private hospital. For Tarlac, next slide. Pinalitan natin. For Pampanga po. Ayan, para yung pinalawagin namin si Dr. Bench. Ayan, for Pampanga, our David on Tarlac Medical Center. It's a private hospital that is providing. Tarlac, ayan po, ang lahat ng ating mga hospital na engaged na sa Tarlac. For Zambales, we have 4. Kasama po ang UniHealth Baypoint. Okay. Strategy number 3 pa rin po, baka pinapakita lang tayo dito for the public hospitals. Sige, i-try ko na lang natin. Kapatid. Okay, that's for the government hospital. Sige po. We can actually provide them a list. Kasi 11:59 na lang sa bench. For strategy number 4, okay, this is more of the community-based organization na nakaka-contribute po to reduce the defaulter for TB. No, ang pinakamarami po defaulter sa atin is garnering an average of 14%. That's the local city. So, nakakahanap po sila pero marami nagde-default. No? Kasama po dyan ang Zambales and Bulacan. So, for strategy number 5, ito po ay the multi-drug resistant TB. Alam niyo po, sa buong Central Luzon, isa pa lang po ang satellite treatment center po natin. No? We are targeting 9 more. At ang isa po naka-establish ngayon is JDM, no? Jose Biligan Hospital, that can cater multi-drug resistant TB. Ang target po natin for the year, ang buong Central Luzon, we are targeting to look or to find for 153 MDR. As of July 11, 103 na po ang human enrollees natin. So meaning, mababa siguro ang target natin at mas marami pang MDR sa buong Central Luzon. So, ito po ang mga target PMDT facility sana namin. Dito lang naka-asterisk na assess na po. Yung mga naka-check, yan po ay nagkaroon na ng MOA. No? So, there was a signed MOA already. So, these facilities will soon be a satellite treatment center. So, yan po yung mga naka-check. No? Kasama po, yung mga naka-asterisk, naka-assign na po yan. Na-assess, rather. Next slide. For the gene expert, now strategy number 6 talks about diagnostic procedures. Sa before July. So last July, nagkaroon na po ng installation of the gene expert. Yung mga naka-underline, yan po yung na-install na ang gene expert. Yung mga may asterisk, yan po yung mga may trained na, hinihintay na lang ang delivery. So we actually have 9 target sites. Next slide. But we added 1. No? Yan po ay ang City of San Fernando, which nung ginawa ang site natin, kasi nila po confirm na, no? Now they have confirmed na tama po ba ang City of San Fernando. So there will be a training this coming 3rd week of August para po ma-train na sila. Yung naka-underline, we already have our gene expert at the regional office, TB Culture Lab. Operational na po yan. Kailan na nga tayo ng basa. 14. So 14 na po ang nagawa ng gene expert. And meron po na-install sa Olongapo City CHO. So for this strategy, we have the different indicators. Mostly naman, 100% naman. Pero po, pwera po dun sa last year, nagkaroon kasi ng stock out ng category 2 drugs. Pero this year, we have assured that there will never be a stock out for that kasi enough po ang binigay ng national office. For strategy number 7, this pertains to certification and accreditation. Unfortunately, as today, we only have 84 certified out of the 281. No, the facilities natin are HU. We still need to certify 197. That's about 70%. So, ilan na? Okay. Good. So, let's see the certification status as of July 31. In Aurora, we have 2 out of 8 TBDOS facilities certified. Ito po ay ang mga munisipyo ng Tingalan, no? At Rosario Camson Memorial Clinic. So they are both certified and accredited. For Bataan, all are certified. Palakpakan naman po natin. Ayan po sila. Next slide. So sila po yan. Pa-accredited sila. For the province of Bulacan, 9 out of 67, that's about 30% are certified, plus 1 private hospital. So, tingnan natin, ano yung listahan natin? Yan, listahan natin. For those facilities na certified. Ito na yung naabang ko ng PHO ng MDG. We have 14 out of 64 na certified and 1 private hospital, that's Premier Hospital. Yes, zero yan ang pag natin ng 78%. So, complete ka. Tingnan natin, alin-alin ko dyan. Please show them. Ayan. So, you have there. Kung alin-alin. Saan po kayo pwede magpunta? Certified and accredited po ito. So, ibig sabihin, pwede nyo gamitin ang inyong PhilHealth. And, actually, ang facilities, if you are accredited by PhilHealth, meron po kayo reimbursement of 4,000 sa PhilHealth per patient. So, yan po ang package ng PhilHealth. Soon, magkakaroon na rin po ng MDR-TV package. For the province of Pampanga, nandito ang ating PHO, Dr. Mar, no? We have actually 27 na po ang ating certified. We still need 21. We have 1 private and 1 public hospital certified. Yan po yung mga Carmel at MDG. Ayan po ang listahan, mga certified na. There. Kung mabig sabihin, marami ng beta po mga kung makaklik na sila. So for Tarlac, 10 na po ang certified. We still need to certify 28 out of the 38. At ito po ang mga certified na list. Yan. Certified by DOH. Yung iba po, certified lang, hindi ba accredited, hindi ba accredited, certified na accredited. And for the province of Zambales, ako, ang kaya natin, konti lang, kasi isa lang po, no, ang certified. This is Kabanggan RHU. Ayan. So, sila lang po ang certified and accredited. For Angeles City, we actually have 4 certified RHU. They have 6, di ba? And these are the social progress under the total fund. So, yun po. So, hindi naman po namin kayo biglang iiwanan sa ere. There will be support, both training